think actually Ms. Ferguson touched on this, that coverage is a great success. One of the highest coverage rates, if not, I'm not sure on my stats here, but if not the highest coverage rate in the country. But the issue is not with coverage anymore, it's with costs. You know, you can hide costs for as long as you can with, you know, group buy-in rates, pooling. But the fact of the matter is, healthcare costs are skyrocketing. And we talked about it with the market share. It's time to tie, and I've talked about it myself, time to tie what our problem is with the solution we have at hand. We need to bring up a whole new industry. We need to support a whole new industry of health information systems efficiency in healthcare. We have the people to do it. Make the business environment so we can make it happen. We have done the studies. Attorney General Margaret Wolfman, I think one of her great successes, agree with her politics or not, is doing all these studies on healthcare. And she's found that this was a huge discovery that market share is an amazingly large factor in healthcare costs and the explosion of healthcare costs. Not only that, but the lack of efficiency, lack of information sharing. These are all things we can solve ourselves. Now it's time to take the studies that Ms. Copley did, time to take the problem, get people on the ground in Beacon Hill and Boston out of the insurance lobby pockets, and make it happen.
Could you repeat the question, just so I specifically?
Do you believe that the mass health reform is a success? If so, why? If not, why not?
I think that, again, we'll go back to the fact that 97% of the people in the Commonwealth now have health insurance, and that's an important fact. I do think that the 2006 law, the way that it was enacted, has been changed significantly, and the costs have become increasingly higher due to that. It went from a basic plan, I think we need to look at plan design, and now it has become a Cadillac plan, where everything and anything is covered. And prescription drugs, all of them are covered, and it's, again, driving up costs. I think we do need to look at it further and reform it, and look at some of the studies that my colleagues here have mentioned. I think we also need to look at tort reform, though. I think those are some of the driving costs, and we need to look at how we're able to reform that within the legislature. I think competition is good, but again, we need to look at plan design and see exactly what we're covering, how we're covering it, and how much money we're spending on it.
Again, you know, we've talked about this a little bit already, but I think, number one, by improving cost containment, there's a lot of things we can do to improve cost containment. You know, John touched about the health information systems. Those are being mandated to primary care physicians at the very time when they can least afford to implement it. You know, so I think that we place mandates on primary care physicians without giving them the support that we need. So first and foremost, we have to strengthen our primary care providers and get more money to them. But I think that what we need to do is we got to set across the industry standards for reimbursement rates. Kim touched on tort reform. I think that I've talked to many doctors, and they all talk. A doctor yesterday in Westminster said to me that if he doesn't order a CT scan for every patient that has a headache, he can be liable to be sued. So he orders thousands of CT scans when the likelihood they probably cause more brain tumors than they're looking for, than they actually discover. So the reality is we have to do more to set care standards and protocols for care so that releases doctors from liability in certain situations. So there's a lot of policy that needs to be established in the healthcare marketplace. I think that we can't do this in a knee-jerk fashion. We have to be measured. We have to be careful. We have the leading healthcare institutions and technology in the world right here in Massachusetts. We can create the model for the entire country right here in Massachusetts. But it takes pragmatic, systematic, deliberative process to establish what is necessary to ensure that we maintain affordability and accessibility for everyone.
A deliberative process that needs to start. We've been studying for too long. We've been looking at paperwork for too long. Tort reform, both of my opponents have brought that up. Tort reform is huge. We're one of the only major, we're talking federal now as a country, we're one of the only major industrialized countries that doesn't have some sort of tort reform. That's a failure for the leading country in the world. And that's a failure for the leading state in the leading